My name is Seenu Reddy. I'm a cardiothoracic surgeon in Nashville, Tennessee, and I'm currently serving as the Chief of Cardiothoracic Surgery for TriStar Health, part of the HCA family of hospitals. So ERAS itself stands for Enhanced Recovery After Surgery. Cardiac ERAS is really those elements of enhanced recovery that pertain to and can enhance the cardiac surgical journey for patients and their families. Well, really, we're not quite even 10 years old. Cardiac ERAS is still, I would say, it's beyond its infancy, but it's certainly in its young adulthood or adolescence. I think there's so much more to do in cardiac ERAS, but just in the brief period of time that cardiac ERAS has really started to promulgate across North America and across Europe and other areas, even Asia, some of the changes that have taken place are, number one, first and foremost, is the understanding to alter the way we treat pain and manage pain for post-surgical patients. Previously, we were very heavy on opioids, and now we've recognized that a multimodal approach to analgesia is so important. The other elements that have changed is that we really are pushing mobilization, earlier mobilization, pushing also earlier intake of liquids and then of solid food. Well, I think the benefits of ERAS are threefold. The number one benefit is to the patient by far. Number two, patients' families benefit as well. And third, I think the healthcare system overall has some benefits as well. Let's go through each of those. For patients' families and patients themselves, the patients have a much smoother journey, both preoperatively, intraoperatively, and postoperatively. By implementing and really utilizing the elements of ERAS, we can make the cardiac surgical journey a better journey for the patient. If the patient has a better journey, then by nature, the families benefit as well. Particularly the burden on families is reduced, the functional activities of those patients are restored more quickly. Now, the third benefit, of course, is to the hospital system. Through standardization and through also allowing more patients to make it through the system in a more timely and efficient manner, the health system benefits too, and many studies are now showing that it reduces the cost of the delivery of healthcare for these systems. By far, the patient's experience is enhanced when you implement ERAS for those patients. Number one, patients are more comfortable in the way that their pain is managed. There's less delirium and less confusion and the side effects that you see with the previous opioid-heavy way of managing patients. Number two, we've seen a reduction in complications such as ileus, as I mentioned, delirium, as also the benefits of being able to be up and about earlier and more quickly during their hospitalization. The benefit of implementation of cardiac ERAS is it doesn't have to be complicated. When you look at cardiac ERAS, there are so many elements to it. Now we're up to maybe 20 different components or elements that make up what many people consider a cardiac ERAS pathway. However, if you're just in the early part of your journey, you don't have to implement all 20. One of the ways that we've seen many successful programs start is by picking anywhere from 3 to 5 of the core elements and then implementing those, whether it's hemodynamic management, goal-directed fluid therapy, opioid multimodal analgesia type strategies, and opioid reduction. Any of those can be chosen and then implemented, and then you can keep adding to it. Well, one of the key elements of cardiac ERAS, of course, is appropriate hemodynamic management. And as part of hemodynamic management, it's goal-directed therapy. What do we mean by all those terms? It just means that we're giving the right amounts of fluid or the right amounts of pressors to the right patient at the right time. One of the tools that's so important in allowing us to do this are tools like the Acumen HPI. What that does for us is give us a very nice graphical data in a continuous format to allow us to manage the patient with less variation. I think at the end of the day, it's the variability in care that really creates some of the negative and deleterious results. With tools such as Acumen HPI, we can not only give very timely care to the patient, but we can give less variation in that care. A recent study that I had the privilege of participating in and being an author in the manuscript of, it was just published in JTCVS, which is the Journal of the Thoracic and Cardiovascular Society. This paper, including over 1,400 patients done in a real-world setting at 3 different hospitals that were taking care of cardiac surgical patients, demonstrated 2 important findings. Number one, with the utilization of things like the Acumen HPI module, what we saw is that patients would benefit with shorter times on the ventilator as well as shorter times in the ICU. You might ask, well, how did this really affect those two variables? Well, what we found was a major reduction in variability of care. So what we saw is that patients were cared for in a more similar fashion, even though they were at disparate institutions. And with that reduction in variability of care, we saw that this meant shorter times on the ventilator and then shorter overall times in the ICU. There's also some interesting trends seen in that study towards a reduction in complications such as AKI. Yeah, I think the hemodynamic management is particularly an area that we can have a lot of impact by utilizing newer technologies, artificial intelligence. We can actually reduce the burden of the management of these patients. For example, if you have modules that give you predictive values and you can predict hypotension, then we can actually get ahead of it and treat hypotension rather than being on a roller coaster of pressors and fluids. Well, with that reduction in variability, you may also be able to have patients that do better because they're not seeing as many physiological ups and downs. Finally, I think for nursing, there may be a reduction in nursing burden because they don't have to call the physician as many times. It's a reduction in physician burden and intensivist time in dealing with these patients. That's not to say that in the most critical patients, we're still not going to have challenges. It just means that for many of our patients, we can really have a much more standardized approach to their care. So one of the key components of cardiac ERAS is that it's a multidisciplinary approach to care. It means that really at the very heart of ERAS is the team approach. And that team can include everyone and anyone throughout the journey of the patient. We really try to partner with everyone from our physical therapists, occupational therapists, nutritionists, certainly our nursing team, but then on the physician side, close collaboration between the anesthetist, the cardiac surgeon, and the intensive care specialist. It's only through that teamwork coming together do you give the very best care for the patient.